Are they coming from a place of shame? Are they, what is motivating some of these feelings? How does he understand these feelings? Does
Yeah.
he feel like he's the only one that ever had thoughts of engaging in these behaviors with animals? Because he's not. So trying to educate him, trying to identify ways to reduce harm, try to increase his support system, and then trying to help him achieve greater levels of, emotional stability and emotional wellness.
Hello, everyone. I am Michelle Melville-Cashon. I'm the Community and Content Director here at Sexual Health Alliance. And today I'm with Dr. David Ley. David will be talking about rethinking sex addiction at our upcoming online event in July. So welcome, David.
Thanks for having me. I'm excited.
Yeah, it's going to be an amazing event. So can you share with us a little bit about what you're going to be talking about at this event?
Well, first, I'm coming in a supportive role, and this is a conversation that I've been part of, since I wrote my book, Myth of Sex Addiction, back in 2012. And one of the things that I just find super cool is that the conversation, the dialogue, the issues have evolved beyond me, and we've got amazing folks, led by Michael Vigorito coming in to lead this, and I get to come in and play a little bit, which is kind of awesome. And so one of the things that has always sort of driven me nuts in this conversation is that people in the sex addiction world claim that the diagnosis or the label don't get used as ways to avoid responsibility. That they claim that they're just offering people treatment and the opportunity to take responsibility and change their lives. And I want people that are struggling to have that opportunity. But it's also bullshit because the label of sex addiction is often used in court proceedings. And I'm going to talk about some of those here in just a minute and even give you some examples. But we found recently, about a year and a half ago, in a very large research study with Josh Grubbs, and we looked at 4 different samples across United States, Europe, and Asia. And I want to say close to 5,000 participants. And we found that the number one predictor of self-identifying as addicted to pornography or sex was narcissism. And if you think about narcissists and them not wanting to take responsibility for their actions and having an external locus of control, well, I did that because you made me do it. Mm-hmm. You can see how the label of sex addict could be attractive.
Right.
And my concern is that when we play into that, we unfortunately are enabling people to avoid responsibility, to externalize control for their behaviors, to act as though they're the victim. And so here's some examples of that. So, and these are all recent, actually. They're so recent that I haven't even included these in my talk. So this is from April last year. This is a general practitioner, a physician in United Kingdom, who had multiple affairs in his surgery. When he got caught, he blamed it on sex addiction, claimed that it was the result of a medical condition. And this guy had been sexually harassing, women throughout his practice and office, and ultimately, the board that licenses practitioners there, saw through it, and they said, no, This is not a medical condition. This is you engaging in behavior incompatible with being a doctor. Now, let's see. Did it change?
Yep.
This, fascinatingly, is a school resource officer in Fond du Lac, Washington County. He got caught engaging in bestiality. He argued that this was because of sex addiction. Now he said in court, I made a lot of mistakes. I accept full responsibility. All I can say, I'm not the same person I was. I just love this quote from him, though. He says, I know it's still a weird thing to hear and it's illegal. I just don't want you thinking I'm a weirdo. I want you to understand that that's what happened when I have alone downtime.
Oh, wow.
Leading to him, engaging in, abusive behavior towards the family's dogs. God almighty.
Wow.
This also last year, and here's another doctor. What is it with doctors? Now, remember I mentioned narcissist. Remember I mentioned, entitled people. And essential narcissism is a form of narcissism that involves entitlement. And certainly we see this here. This is a doctor in Arkansas who was caught on camera, exposing himself and allegedly masturbating in front of, three female staff members that worked for him. Yeah. When this went before the board, he again complained that it was because he was a sex addict. And and he was also he also had a history of over prescribing medications to himself, etc.
Wow.
Again, this guy did lose his license for 3 years. We'll see what happens in 3 years if he gets it back. And one of the things I'll talk about during our training is some similar cases where people were able to actually hang on to their license to practice, sadly.
Oh my gosh.
Here's one in, again, United Kingdom. Now, here's a police officer who had a history of a lot of seeing sex workers. And this had gotten pretty public, and he then claimed that when his job was threatened, that he was being discriminated against because he was a sex addict.
Wow.
Now it raises a question: is sex addiction a protected health condition under workplace health discrimination law? In the United States, there have been multiple decisions that have indicated that no, it is not a protected health condition. But in Brazil, a woman self-identified as a sex addict to her workplace and was given the accommodation that every day she could close her office and masturbate for 30 minutes while watching porn on the work computer.
Wow, that's fascinating.
I need her employment lawyer, clearly.
Right.
This Met officer, however, he argued that actually he had OCD because he tried to cover up his sex addiction and say that it was OCD. Sometimes it is.
Yeah.
But they ruled that no, his going to sex workers was not a covered disability.
Mm-hmm.
Here's a couple of sad cases. In Utah, Jody Hildebrandt was very well-known sex addiction therapist, and she had a business partner named Ruby Frank. Ruby Frank was a parenting YouTube influencer. Mm-hmm. And last year, let me see when this was. This is 23. A child escaped from Ruby Frank's home, starving,
Oh,
The police and Child Protective Services got involved, of course, and they went to jail for serious abuse of children.
yeah.
The sad thing is that they were encouraging this to millions of viewers on YouTube. They had a very, very popular YouTubing channel that argued for clinical justifications to be awful to kids. Really
Oh,
harsh parenting.
oh,
And after this happened, a number of clients of Hildebrandt came out and identified that she had been abusing them in therapy. And even though they went to therapy for other issues, she decided that they were sex and porn addicts, and that became all that she would talk about or treat them for.
oh my gosh.
And then sadly, a another Utah therapist, and Utah is the national capital and frankly the world capital for porn and sex addiction treatment programs.
Yeah.
And it is not accidental that Utah is also the capital of therapists who are treating porn or sex addiction that then get arrested for engaging in sex and sexually abusive and criminal behaviors.
Interesting.
And here, a therapist had been sexually assaulting a female patient, a juvenile female patient, and telling her during the abuse that his behaviors were because he was a sex addict.
Oh,
He did ultimately go to jail. But some folks, as we'll talk about during the training, some folks, these claims are successful and they avoid jail in ways that I don't think are healthy.
mm-hmm.
So one of the other things, though, that I'm going to talk about is if a person comes to you and they say they're struggling with problem sexual behavior that could get them in trouble with the law, how do you work with them? And how do you decide to work with them? Now, all of the people that I just showed you, with the exception of the one guy with the dogs, right? He sounded kind of crazy and kooky and a little sweet.
Yeah.
Might I have been willing to work with him on changing or controlling those behaviors? I might. Depends on how he walked in the door.
Yeah.
Oftentimes, if folks are coming in the door when they're already in trouble, it is an uphill battle. But some folks come in the door and say, I'm struggling with this behavior or this desire. And I know if I get caught, I'll get in trouble. And I want your help to change the behavior. So one of the things we're going to explore is how do you know which ones you can help? And if you try to help, what kinds of things can help? Now, Michael and I do a much longer 9-month problem sexual behavior certification that goes into much more detail about that. And this training is actually the kickoff for the next iteration of that training. And I'm just so excited. And the neat thing about all of this work is that we're offering clinicians and coaches and therapists and counselors, we're offering them tools that are more helpful and based on more accurate science than telling somebody that your behavior is an addiction, you need to stop that shit. Because that doesn't help. Instead, it just increases shame, and that shame increases feelings of discontrol and dysregulation.
Yeah.
So imagine if I was working with that guy with the dogs, and what are some of the things that I might recommend? I might recommend, behavior tracking and helping to identify when urges or thoughts of engaging in sexual behavior with the animals come up, to help us to start track and identify the behavior. The more we know about a behavior, the more we can interrupt it and control it. Yeah. Secondly, I would recommend, dude, you got to talk to your wife about this, and you probably need to get rid of the dogs.
Yeah.
I think let us put some harm reduction strategies in here, right?
Right.
Bringing in the wife is important because this is not work that people can do alone. They really need a support system.
Yeah.
Lastly, I would be trying to uncover and expose his thoughts and feelings about these desires. Are they coming from a place of shame? Are they, what is motivating some of these feelings? How does he understand these feelings? Does he feel like he's the only one that ever had thoughts of engaging in these behaviors with animals? Because he's not. We actually know a good bit about people that engage in bestiality. So trying to educate him, trying to identify ways to reduce harm, try to increase his support system, and then trying to help him achieve greater levels of, emotional stability and emotional wellness are all the things that are going to help that guy.
Yeah.
Now, here's the sad thing is, I almost guarantee that poor guy didn't get any help like that.
Mm-hmm.
He was probably put on probation. He was probably sent to therapists that don't have the skills
Right.
to work with these issues. And that's why the training and the work that Michael is doing, that's why the work that Sexual Health Alliance is doing is so important, because it is spreading accurate, effective skills and information to help people that otherwise wouldn't get it.
Right, because I think most therapists don't have basic sexual health training to begin with. And then if you go into these more specific topics like problem sexual behavior, there's really no information, available for therapists other than, like your book, Michael's book, and our trainings. There's really not a lot out there.
Yeah. Now, again, I will say this has grown so much, and I'm just. I like having other people that get in trouble for challenging the idea of sex addiction, so it's not just me.
Right.
But Silva and Naves, who is a co-presenter, he's got a book on this, and he is the lead challenging these issues in the UK, and it is extraordinary. He is changing the world in the United Kingdom around this, and is calling out, Michael and he both call out something that I think is just so important, and that is the degree to which claims of sex addiction get used to shame people for having non-heterosexual desires. Mm-hmm. And Utah, again, several programs out there have gotten in trouble in recent years. They are wilderness programs, or wilderness programs for residential treatment of adolescents. And porn addiction and sex addiction was a label frequently used specifically for any kids that came in that were queer.
That's terrible.
And we've got to change this so that people get effective, affirmative, accurate care that is not based on, I don't like your sexual desires, so there must be something wrong with you.
Right. Like, do you actually have a problem, something you want to work on? Or is it just shame from other people telling you that what you do doesn't align with how they think things should be?
That's right. So, the world is changing. And since I wrote that book, 13 years ago now, wow. It has, these issues and dialogues have changed incredibly. Although, as I just showed you, they're still popping up in the news. And, a Supreme Court case that I was just involved in, at the Supreme Court hearing, Justice Amy Coney Barrett said, quote, "There is an epidemic of porn addiction on the internet today." So these labels are still getting used. They're getting used at very high levels, at the highest level. Supreme Court talking about porn addiction. And that stuff filters down. So the more we can challenge this and identify more accurate, effective information, the more we help people who are struggling, and the more we avoid situations where people are using their sexual behaviors to hurt others. Yeah. The more we avoid them avoiding responsibility for it.
Right. And so here's a fun fact for anybody who is in the Sexual Health Alliance community or who reads our blog. Every year we look at what are the most top search terms, like how people are finding our blog. And it's always Tiger Woods sex addiction is what pops up. That's like a top, probably I think number 3, I think is that one.
Yeah. Yeah. It's funny. So Tiger, I didn't, can't remember. I think I did include this in the book, that Tiger Woods's coach, or former coach, came out after the sex addiction allegations and stuff, and he said, it's not just sex. Tiger acts like this to everybody in all kinds of ways, and that was again one of the central things that I was thinking was, we're saying this is just about sex. But aren't these people just kind of acting like douchebags in lots of ways? And why are we focused on the sex?
Yeah. So I have one more question for you. So when did you first realize that you wanted to challenge the sex addiction label?
Oh, so in my first book, Insatiable Wives, I interviewed a man who was desperate to see his wives. He'd been married 3 times, desperate to see his wives with other men. And I think 1 or 2 of the wives tried it, didn't like it. But they all said, no, we're not doing this. It's not going to happen. And I said in the book that it would be really easy to diagnose a guy as a sex addict, but I don't believe in sex addiction. Mm-hmm. And I believe that. I stated that because sex addiction wasn't in the DSM. It wasn't accepted at a general level. And after I wrote that book, I heard from all these people who were like, what, you don't believe in sex addiction? And I was like, no, this isn't real. And honestly, I found out then how large the sex addiction industry was and how much the idea had infiltrated mainstream thinking. Yeah. So I started investigating it. I was really surprised people took it as seriously as they did. Shows how sheltered I was. And I found that, the concept of sex addiction was not scientifically based, was that there really was no good evidence for it. And I found that the concept was something that was really being used for moral purposes. It was being used to bring concepts of, heteronormativity and monogamy and, suppression of sexual desires into clinical practice so that you had clinicians pushing these ideas, not realizing that they were pushing morality.
Yeah.
And I was really bothered by that because, our industry has a long history, unfortunately, of harming people when we allow morality to intrude into clinical practice, whether we're talking about satanic ritual abuse movement, the recovered memory movement, we're talking about, rebirthing, children have died with therapists engaging in rebirthing attachment therapies. And I saw that this was really kind of a cult and a dishonest one. And so that was, I wrote the book and because I thought it was important. Now, if I had known what a challenge the challenges I was going to experience after it, whether it's the death threats and the lawsuit threats from sex addiction therapists, and I'm not kidding, they're both death threats and lawsuit threats from actual therapists who believe in addiction. And
was it like therapists individually or like organizations or both?
Both. NoFap right now is threatening to sue me. They haven't gone through with it, and we'll see what happens. Maybe this week I may know something by the time of the talk. But it became important to me because I saw people who were harmed. I saw people who hated themselves and hated their sexuality. I saw people who, treated their desires for gay sex or non-monogamous sex as a disease, and I saw that harmed them. It made their problems worse.
Yeah.
And I wanted to change things for them. They deserve better from us.
Yeah, definitely. So if you have one takeaway or tip for anyone watching this video, what would that be?
Buy my book, buy Michael's book, buy Silva's book. That's the place to start. That sounds self-serving, but really, if you question the idea that sex is a disease, you're not alone. And you're going to learn lots through this weekend that will give you ammunition and support to argue against those people who tell you that you want sex too much. Mm-hmm. And hopefully you're going to walk out with some better understanding of why those people are saying that.
Yeah, that is a great tip. All right, we're going to do something fun. So this is something new we've started doing. So the previous interview asked a question to the next interviewee. So this is purely for Michael's enjoyment too. So my previous interviewee was Michael Vigorito, and his question for you, Dr. David Ley, what's it been like to work with Michael Vigorito while also having such an intense infatuation with him?
Oh man, it has taken every ounce of self-control that I have to avoid just jumping the guy's bones. I try to make sure that whenever we meet in public places so that, there's a crowd around and I have to restrain myself. But it's not easy. And I really hope everybody can empathize with me. I mean, you're going to spend the weekend lusting after Michael Vigorito. I mean, Italian stud of a man. And then he's got this giant brain and God almighty. So yeah, Michael, I'm glad I can finally admit the truth and thank you for hearing me.
I'm so glad we were able to open up like this on YouTube and share this with everyone. All right. So now for you, our next presenter is Dr. Wendy Miller that I'm going to interview. So do you have a question for Dr. Wendy Miller?
So, Wendy's expertise is around sex and technology. And I just have to ask, have there ever been a time that you struggled to afford your electric bill because of all of the vibrator usage? And would you be willing to graph it out for us so that we can see, are there certain periods when you're using more electricity and why?
That is a valid question. I will make sure we get that to Wendy. All right, everyone. If you are interested in attending our event, we would love to see you there. Our event is going to be July 19th and 20th. It's called Rethinking Sex Addiction, Treatment for Out of Control Sexual Behavior. If you like this video, please click the like button and subscribe. And thanks for watching. And thanks for being with us, Dr. David Ley.
Thank you, Michelle. Always great. Appreciate you doing this.
Thanks for watching our video with Dr. David Ley. Do us a favor, share this with someone who might benefit from this information. Your support helps us reach more people with important sexual health information. And if you're passionate about this space, we know you'll enjoy these videos, so check them out. And remember, if you love this content, like this video, subscribe to our channel, share it with a friend, and always remember, you are exceptional.